If someone has external rotation already, which is very common for a lot of foot, knee, hip, and back problems, people are already in external rotation a lot of the times. And you can observe this if you have your client walk down the hall or in the room. You can notice that a lot of people will have their feet pointing out, and that's external rotation in the foot that is coming from either external rotation in the tibia or in the femur. And this pattern of external rotation is much more common than internal rotation, okay? Now, to balance that external rotation, we're going to want to internally rotate their leg. So I'm gonna stand on the same side of the table. I'm gonna take a lunge position where my front leg and knee are bending, and I'm going to do a Tai Chi type movement as I push rather than rely on my arm and hand strength. So to begin, if I want to internally rotate their leg, I can start with one hand above the knee and one hand below the knee, and then I simply push and rotate in, and then walk out, push, rotate in, push, rotate in. Okay, now you can do that 3 times in each section, or possibly even 4. There's a few different ways that we can do this. The most basic way to begin is to place both hands at the level of the knee, one just above and one below. Push, rotate in, and then walk the palms out until you get to the ankle and the hip. Check for tension, tender points, and then walk your hands back in towards the knee, okay? So here I want to demonstrate how we can press and roll. And it's good to do this 2 or 3 times at least. I'm pressing and then rolling, pressing and then rolling. Another technique that you can use when there's excessive external rotation in the foot and in the tibia is you can anchor the hand above their knee. So I want to hold the femur, and I'm even going to pull this way. I'm going to pull her femur towards me, not too hard, just slightly as I do this. But then with this hand, I'm going to internally rotate her tibia, okay? So I'm doing this kind of motion. This hand's coming towards me. This one's going away from me, because I've found that there's too much contraction within biceps femoris that's related to the external rotation in the tibia and in the foot. So as I hold her thigh just above the knee, I'm pulling it towards me slightly, and then with this hand, I'm internally rotating it. Now, what that's going to do is that's going to help to correct that external rotation that's present in the tibia and the foot. And you can do this in a way that's very nice and it's very comfortable. The clients enjoy this. You don't have to be really intense with it, just gently rotating